the other piece that is really important is to anticipate situations where you might be at risk of relapsing, of sliding back into that pattern. And because we're wanting to think of this as a dependency as opposed to an addiction, relapse is probably going to happen. Because I'm looking at behaviors that some of them are more harmful to me, some of them are actually beneficial for me. I'm being rewarded by my body. I'm just trying to make sense of what's really helpful, and I'm overall trying to improve my life in all areas so that maybe within a period of time, like a year or two, I can make sure that all my activities in my life are helpful to me. So it's a journey. We're looking to satisfy our cravings, and one by one, just notice whether or not the craving that we're satisfying is healthy for us. And if it's not, then we can start to say, well, I need to find ways to reduce this one, and I might need to reduce that one, and it's a journey. Yeah. Very, very true. And we can also have, so sometimes we might need help with that, because if we have a dependency which is covering over another problem, an emotional problem, okay? So if I have, we talked here about the lower baseline. And if I'm using a substance to cover over depression, then I'm going to need help with the depression. And that's where we recommend psychotherapy. Certain kinds of counseling can be beneficial. Talking to others who have been through the same types of difficulty, getting emotional support in our life. Okay? If we try to address a dependency and we struggle with it's continuing, that's basically how we know we need more support than that. Actually, we recommend no. The thinking is that if we try to do that, the risk is that working on the underlying issue would push us further into the dependency or into other dependencies. Yeah, because to open, to do personal work, well, it's going to take. We're going to open up some painful doors. So we want to make sure that we're at least controlling and managing the outside dependency at the same time. But I do believe that we can do the two at the same time. Absolutely. Yeah. Yeah. So, that's part of the work of therapy, is to address that. That's a therapist would be aware of hopefully would be aware of that risk, and would ensure that self-responsibility was part of the work. So the antidote for victimization is self-responsibility. I could talk for an hour on that topic, but yeah. Yeah.
You should schedule that.
Mm-hmm. No, I would say that based on this, we do need to address the underlying issue.
But just increasing the baseline.
Well, the underlying issue is an issue as long as it has, the question of childhood trauma, for example, is whether or not it's a problem depends on how I'm coping. It may be that I've resolved it internally. Not every person needs to process trauma the same way. So sometimes, and it's just a very personal thing. Some people need to do more work with it. They need to help resolve any unfinished issues that they have, unfinished or unresolved feelings towards parents or towards peers or wherever the source of the trauma was in their childhood. Other people don't, and we're affected by our temperament in terms of how we manage that kind of trauma. So I would say that if I'm struggling today and my mood, we talk about mindfulness as being a really valuable complement to this type of therapy, because mindfulness brings me back into the present moment and allows me to just be present. And that's where I will feel, if there is depression, I will observe it. And again, people that are trained in teaching mindfulness can talk about how to listen to and be curious about the depression, but just to notice it and observe it. But if it's a problem, then we can address it directly. Is that answering your question? Well, therapy, and first of all, I do want to, we use the word addiction, and I want as much as possible keep coming back to the word dependency. We're really moving towards replacing the word addiction with dependency. And so the dependency is problematic, and through the process of therapy, if I'm struggling, some of those ideas that I had about what's my motivation to change that dependency, and what are good choices I can make, and if that's not sufficient, then through the process of therapy, we can start to explore what happens when I try not to cover it over. How do I feel about myself, and how do I feel, what are the challenging emotions that are present? And therapists use different modalities in order to address that. So some therapists might be more in the here and now, and some might do the early childhood work. And the therapists are trained in each approach. So, and as a client, if you're seeing a therapist, if it's helping, then keep going, and if it's not helping, find a new therapist. That's a simple rule. And interviewing therapists is a valid and an important thing to do. You meet a therapist, and you really need to trust your intuition. I mean, if you're booking a session, that's a bit bigger. But if you're wanting to meet briefly and just get an intuition, or get a sense of the person, you can do that. I mean, it's up to the therapist to let you know if they're comfortable with that or not, but most will.
If they say no, that's not
Sure.
That's the law.
The research suggests that there's research about how to know if the therapy is going to be effective. Okay. And the research suggests that within 4 or 5 sessions, really regardless of the issue that you're looking at, you should start to see some benefit. Something will be making sense for you, some change is happening. I mean, sometimes therapy is long term, but even in those cases, within 4 or 5 sessions, you'll know if it's a good fit. And if it's not, even if you like the therapist, but nothing's changing, then that's usually, about that point, I would say, seriously consider requesting a referral, or, and as therapists, we're meant to understand that and respect that decision, absolutely. So, it's a very personal thing. Obviously, the therapist needs to have knowledge in the area that you want to take a look at. So if it has to do with dependencies and behavior patterns that you want to address, the therapist needs to have some knowledge in that. But the other piece is, do you feel comfortable working with them? So, are there any other questions? Because that is the closure of the talk. But I'm open to any other thoughts or questions you might have right now. Well, it depends on the pattern. Just to let you know, so there are ways that I rationalize my recovery process. And one of the very common pattern is relapsing after 3 months, 2 or 3 months. So I have succeeded in abstaining from something long enough to convince myself that it's not a problem. I gain a false sense of security. The dependency is actually saying, see, it's not a problem. That's its way back in. And then I relapse. And so if you're relapsing every 2 or 3 months, then I would say, yeah, that's something that you now need to know is a risk. And you need to anticipate, what will I do? What do I need to change about my story that I'm telling myself when I catch myself feeling confident because I've gone for a period of time successfully? Can I recognize that confidence is actually a trickster, ready to work its way back in? Because we used to say, it's the addiction talking. It's kind of nice to externalize it that way and see it as an external voice. But what I prefer is to recognize that the body assumes that the substance or the behavior is essential to my survival. So it doesn't like to give it up. And the body's incorrect, the mind is incorrect in this assumption. And I just need to be patient with it and know that it's going to be trying for a long time in many different ways. And every time I relapse, what did I learn from that I need to change in the future so I don't relapse that way again? That's all. Does that help? Good. Good question.